We know what barcodes did for our common shopping experience. They sped up the process, reduced human error, and shrank supermarket queues. The experience of counting and keeping track of millions of items became a breeze. It made buying your next box of cereal effortless. So if it did that for cereal, what if we told you that barcodes are helping to save some of the most fragile human lives on the planet? Every day, high-risk and critically ill babies cared for at Mount Sinai Hospital's Neonatal Intensive Care Unit are being helped into life through a new application of a tried and true technology. It puts your next cereal purchase into a whole new perspective. But that is the great promise of technology, to improve the human experience and to save lives.
There are multiple steps in order to provide breast milk to the baby. So these steps would include collection, storage, preparation, and administration. So at each of these steps, there's a potential risk for viral and bacterial transmission. So in order to reduce that risk, it is essential to have a strict standard in the way breast milk is handled.
With our new barcoding and scanner system, coupled with the timeless milk tracking system, we've been able to dramatically reduce errors while ensuring patient safety, and at the same time, very importantly, supporting and promoting breastfeeding and the provision of breast milk to our smallest patients in the NICU.
Breast milk is the gold standard for feeding babies, but breast milk is a bodily fluid, so as much as it provides nutrition, it can also transmit organisms. So it's vital that we ensure that the right baby gets the right milk. So for us, the wireless scanning has been very valuable in making sure that the errors don't happen.
So all patients are given a unique barcode wristband when they're admitted to the hospital.
Our mothers do call in. Sometimes they want to know how much milk is in storage, or the nurse wants to know if milk is expired. So they don't have to worry. It's not going to take them a long time to find that information. Basically, it's all within the barcode. It's accurate, it's quick, and basically it's a scan away and they'll have all that information. The milk is delivered to the NICU and it's placed in the patient's fridge. And it comes in pre-filled syringes, and on that syringe has the baby's name and the barcode. Prior to the feeding, the nurse scans the baby's barcode, scans the barcode that is on the milk, and looks for that positive match before they can feed. And at Mount Sinai, we scan about 475 syringes a day, which works out to almost 175,000 a year. So we use the scanner quite often.
The programs allowed for a more efficient preparation process, which has enabled us to serve a greater number of patients per day.
Women's and Infants is a hugely important priority program at Mount Sinai Hospital, and the Neonatal Intensive Care Unit is a huge part of that. And really, as the nation's leading neonatal intensive care unit, it's something we take great pride in and feel great responsibility for.
Information Services' mandate is to enable the best possible patient care by providing the right information to the right person at the right time.
Critically important in protecting, supporting, and promoting breastfeeding is ensuring the provision of the right mother's breast milk to the right baby. That's why we set out to develop this wireless positive patient identification system. It's all about the patient safety.
We are more dependent upon technology than we ever have been in the past. However, technology at its best is here to serve us, to help improve how we perform our jobs. Mount Sinai's hospital barcode tracking system is a perfect example of this. Through an interdepartmental team spanning from bedside nurses in the neonatal intensive care unit and nursery, to pediatrics, to nutrition and informatics, the hospital has achieved a significant milestone for patient safety. Through barcode tracking, they are helping to ensure the most fragile patients are receiving the best chance at not only surviving, but thriving.